Hello everyone and welcome to our today's show. Today we are going to talk about expired medicines and all the information we need to know about the expired items. We have medicines, and before we start there, we want to see exactly what is expired medicines and what is an expiry date. For example, I will give an example here. We have an antibiotic here. This is an antibiotic used by doctors for treatment of various diseases, and if you look here, you will be able to see an expiry date. Let me just turn it over, and if you look clearly, you can see this one is expiring in 2021. Let me put it upside down, and yep, that is it, 2021. Or I can use this other one. This is an antacid gel, as you can see here. It's called by the name Relsa gel. I will just look at the expiry date where it is, and here it is. If you can look properly, you can see expiry is December 2022, and the year of manufacture is January 2019. So normally each and every medicine, the package, depending on the package, you can see them from different packages and from either at the top or the side. Some are written in bold, some are printed. So what we want to talk about today is what is an expiry date and what happens when the drugs are expired, and what exactly do these dates mean and when did they start. And how bad are these expired medicines? What is an expired medicine? Can they harm you? When did this practice of expired medicine start? Well, that would be the center of our discussion today on Patient Info. But first things first. First, what is an expired medicine? Well, expired medicine is medicine that have reached or passed their sell-by date as indicated on the packaging. So you look at the packaging of the medicine and you'll see whether the drug is expired or not. I've given an example of the antibiotic here, and the expiry date is written here. It might not be very clear, but that's where the expiry date is written on this medicine. So you just need to check where it is written. So we have just said that, but expired medicine is the meds that have reached their sell-by date as indicated in the packaging. And why do they put expiry date? Well, from the date of manufacture, there is normally a small continuous chemical reaction that actually occurs in the tablet. This reduces the quantity of the original active ingredient in the medicine. The active ingredient should always be at least 95% and not more than 105%. So if you take this medicine, antibiotic, and you look at the expiry date within the 4 years that have been given, 2018 to 2021, the active medicament, which is levofloxacin, when it is analyzed by the experts or the regulatory authorities, it should not be less than 95% of that levofloxacin antibiotic inside this tablet. So they know there's normally a chemical reaction that goes on inside the tablet that can reduce it. So by the end of the 4 years, they know it will reduce to either 95 or less than 95, and therefore that's why they put those dates. So by the end of the 4 years, the quantity of the active ingredient cannot be guaranteed by the manufacturer. It may be still correct at 95%, 100% or more, but there is also possibility that it might be less after the period that is written on the packaging. So that's why we say it cannot be guaranteed by the manufacturer if you use it after the sell-by date. Normally this period is about 4 years for many medicines from the date of the manufacturer, and this is called the shelf life. So let's take, for example, paracetamol 1000 milligram or 1 gram tablet. It contains 1000 milligram of paracetamol as the active medicine, and many other substances like coloring, binding, stabilizers. You can see some tablets are white, some are red, some are green. Those are just other what we call excipients in the tablet, but they don't help you in another way. They're just used for making the tablet. For example, if the tablet is manufactured in the year 2020, the expiry date will be about 2024. This means that the tablet is stored, if the tablet is stored well, it will have a shelf life of 4 years. Within this period, it can be used. The active ingredient, which is paracetamol, should not go below 95% within these 4 years of the shelf life. The minimum is set by the 95% to 100% is the minimum set by various regulatory authorities in many countries. So when they do analysis or they do the quality test, they'll be doing with that within that expiry shelf life, and the content should not be less than 95% and should not be no more than 105%. After 4 years, the quantity of paracetamol may still be 100%, but it may be much less. It can also be less than 90%, 100%, or it might have reduced maybe even 80%. If it reduces to less than 95%, it will fail quality test by the authorities. So, from the above discussion, it is clear that expired medicines have their active content reduced or the quantity in them uncertain. So they may still have 100%, they may be having 98%, maybe 95%, but it may have also reduced. So we are uncertain. And you cannot take the manufacturer to task if the drug doesn't work on your ailment. We cannot be sure, in short. Expired meds pose no danger. They do not turn toxic or dangerous overnight just because they have expired. In fact, many are as good as any other medicine, or moreover, still effective in the ailment. Secondly, strictly speaking, every individual have his own requirement for medicines. The general dose for paracetamol, for example, is 1,000 milligrams every 8 hours. This is a generalized dose for all adults for the sake of convenience and simplicity. This may underdose or overdose some patients depending on their body weight, surface area, liver, and kidney functions. Meaning, there are individuals who may actually need 800 milligrams of paracetamol and not 1,000. So, today we have discussed, the truth. Nobody should tell you that expired medicines are dangerous, they will harm you, they'll do this or no. It is just that the quality cannot be guaranteed, but not the safety. It's the quality. And since everybody needs their own individualized doses, it may even actually the reduction could even be good for you. Maybe you need slightly less than what is the average. Thank you very much, and please do remember to like, share, subscribe, and if you have any question, we'll be glad to answer you. Drop us an email on the email on your screen. Thank you very much, and bye. Until next time on Patient Info, keep visiting us, and we'll be having much more discussions on drug, medicines, information for the patients at home. Thank you.